It's often to get, family members that are quite difficult because they love them, and they're trying to do everything in their power to like, no, I want to help grandma, I want to help whoever. But these difficult patients, man, if I can get them through and, I can let them live a healthier life and maybe a longer life, I mean, it's worth it. You can call me every name in the book. It doesn't matter as long as,
Well, speaking every name of the book, as a woman in healthcare, have you faced discrimination, rudeness, abuse on the job?
Yes. Very often.
Are you comfortable sharing an experience or two?
Certainly. Yes. Certainly in the sense that I have had several situations where they would prefer either not even just a male nurse, but they just only want a male doctor. It can't even be a female doctor at this sense. And a lot of times, I mean, I don't want to say it's degrading because I feel like it's coming from a mindset that they're not understanding the situation that's going on, because whenever it's a life and death situation, I typically would think that you want anybody in your corner, you know what I mean? And it's like we all have licenses, be it different licenses and stuff like that, but we're all educated in the sense of we have a role and we know what we need to do. And when somebody tells you, I don't want you treating me because you're a woman, I don't want you treating me because you're Hispanic, it gets very difficult. I mean, because it's very hard to break through that because you're there spending time out of your life and you spent all this time, this very difficult time going to college and stuff like that just to help people. And for somebody to tell you that they don't want you to help them because of the way that you look or your nationality or any of that stuff, it's very disheartening because also too, 9 times out of 10, we don't have the staffing to be able to accommodate that anyways. It's going to be a situation like you came in for an emergency. We have somebody available to help with this emergency. But for somebody to refuse care specifically just because you're a female or because of your race or anything like that, I mean, it's very eye-opening. And usually any of those situations that I've had, especially with male doctors that will come in and say, listen, this is the way that this is, and this is her role, and these are the things that she's doing, and she's here to help you. And they will stand there with me and explain the situation and say, this is important that you get this blood drawn and stuff like that. And 9 times out of 10, too, the doctors will say, the nurses are the ones who do this all day long. The nurse is the one you want to draw your blood. The nurse is the one that you want to do this. You do not want me to try to attempt this, because I haven't done this in a while. She does it all the time. And then they get to a point to where it's like, listen, this is your only option, and she's going to do it, and she's great at it. And, you're either going to let her do it, or, I can't help you. And so if you have, a good team behind you, it's not as hard. I mean, it's hard to take home with, you know what I mean? Because it goes through your head to where it's like, somebody didn't want, you to help them or to treat them because of factors that you can't change.
Of course, yeah. So do you think everywhere you've worked, because you worked in so many different locations, that you've had this supportive team? Or have you had, discrimination as a woman in even a professional sense, or no?
I've had one situation that I'd say that's actually here, in my home state of Texas, where I've had somebody who was a male doctor who was extremely, extremely rude to me.
Wow.
And in that situation too, I refused to back down, and I wasn't gonna let somebody just steamroll over me. And so in that situation, I felt like I kind of stopped him because I don't think that he was used to people calling him on what he said. And so at that situation, I was like, no, I think we need to have a conversation, and we need to sit down, and we need to have this one-on-one, because I don't understand where this is coming from, and this is very disrespectful. And so I think at the end of it, having a conversation with that particular doctor, we were able to clear things up. But I want to say that typically throughout the places that I've traveled, people have been very kind and very receptive. It's usually in the smaller hospitals that you kind of deal with differing types of mentalities. But mostly, especially working level 1 and stuff like that, you're in very dense areas, very big cities. Yeah. But if I do go out to the outskirts of wherever and you just look a little different, it's definitely a different feeling.
Yeah. Well, that sucks that you had to go through that. I'm sorry. But it sounds like a good learning opportunity for the doctor that you gave him
Definitely.
A wake-up call.
Yeah. I was like, no.